Welcome everybody. It's Dr. Amy Harris-Nuon. I'm glad you're here for the webinar. Just want to let you know I'm excited about what is coming up for this webinar. Welcome to Restore, Regenerate, and Repair. It's my great hope that this will be informative for you, that it'll help you be in a position where you can get a lot better health outcomes. More options, maybe some options that are new to some of you, maybe some options, that, you've heard of before, but just didn't understand fully how they can help you. So I'm excited that you're here. Again, welcome. I'm Dr. Amy Harris-Nuon. We'll wait just a couple of minutes for other people to get started and to log on. So just want to check the tech here. And again, I'm going to try and share my screen with you. And if for whatever reason, if we get bumped out, I will log back on. Just hang with me. That has been known to happen with Facebook Live. So it's certainly frustrating, but I'm up for a challenge, and I'm going to find a way to work around it and get you going any way I can. So yeah, so we'll wait just a couple of minutes. All right, let's go ahead and get started. So I'm Dr. Amy Harris-Nuon. Welcome to Restore, Regenerate, and Repair. I'm going to share with you how to avoid surgery and what you can do with regenerative medicine. So just a little bit about myself. Let me share my screen here. I'm Dr. Amy Harris-Nuon. I'm a double board certified integrative and interventional clinical psychologist with a postgraduate specialization in functional health and wellness. I'm also a best-selling author, speaker. I'm a frequent speaker at Harvard. And I am the director for the Center for Integrative and Functional Health and Wellness. I'm also the host of the Mind Over Matters radio show. And that appears every Sunday on WCPT AM 820 at 10 a.m. on Sunday morning. So tune in this week. I'm going to be talking about the importance of strengthening relationships and certainly building relationships, and what you can do to not just strengthen your relationships, but strengthen your body, mind, and spirit. So so that's a little bit about me. We've been doing regenerative medicine here at the practice for quite some time now, and I'm excited to share with you what's news, what's the possibility. So without further ado, let's dive right in. I want to talk about avoiding surgery with stem cell therapy and other regenerative options. The goal is to provide a background on the current state of affairs with regenerative medicine. I want you to, know that there's a better standard of care out there. Right now, the current standard of care is really focused on disease management or symptom management. It's a standard of care of Band-Aids, really. But I want to show you how regenerative medicine can help to regenerate tissues in our bodies that have been damaged over the years. Also want to clarify how the FDA views stem cell therapies in the U.S. And then I want to delineate the difference in stem cell therapy and other options that are available as well, because there are several regenerative medicine options. But, I do have to give the disclaimer. Want to share that no statements or treatments from the Center for Integrative and Functional Health and Wellness or our affiliates have been evaluated by the FDA, so I didn't send this PowerPoint to them for approval. I didn't send it to Facebook for approval. Want to make sure that you understand that procedure outcomes vary between individuals, okay? We take a deep dive and look at your situation, and we're going to help you understand what the best treatment options are for you. And neither myself nor the Center for Integrative and Functional Health and Wellness or our affiliates were not making any medical claims regarding regenerative therapies. I have to put that out there. Our lawyer says we have to. So, I want to invite you to view a masterclass. Go to stemcellmasterclass.org. It's the best resource available for prospective patients, your family, and your loved ones. It's really kind of cool because there are 8 episodes and over 4 hours of content that are designed specifically for you, the patient. There are doctors talking about their experiences in regenerative medicine. There are patients talking about their experiences. And personally, I have found it to be very helpful, as well as our other regenerative medicine clients. So, My promise to you, over the next 45 minutes, you'll learn a lot about stem cell therapy, and hopefully you'll have a really good understanding about the procedure and your treatment options. And we'll have a very special offer for you at the end of the talk to thank you for watching. So, surgery should be your last resort, okay? This is really, really important. A lot of times when we go to a doctor, maybe we've had chronic pain, or we've got a shoulder injury or neck injury or a knee injury, back, whatever, you're basically given two options, surgery or medications. I'm sure you've heard that before. Well, it looks like you'll need a surgery or procedure. That doesn't have to be the case, though. Let me give an example. Arthritis of the spine or extremities is not a deadly disease. What do I mean by that? How many of you out there are dealing with this, whether it's arthritis or some other chronic pain? But the truth is, it kind of is a deadly disease because it's really a quality of life killer. And I think many of you would agree with that, especially many of you that are living in chronic pain. And the truth is, we're seeing more and more patients, younger patients in their teens and 20s, dealing with chronic pain. So while chronic pain might not be a deadly disease, it definitely is a quality of life killer. And traditional non-surgical options for tendonitis, arthritis, they've helped with pain relief, but they've not helped repair the damage. This doesn't have to be the case. A lot of times the standard of care is a steroid injection. That is known as the gold standard right now for these kind of things, but it doesn't repair the damage like regenerative therapies can. So again, it's a band-aid. And if you don't deal with the root cause of the disease, the dysfunction, or the illness, it is going to become more and more chronic. Okay, so no longer is it the case that you just have to have a pill or a steroid injection or cortisone injection as your only treatment option. And certainly surgery doesn't have to be your only option. So, regenerative medicine offers repair and relief. It's meant to regenerate tissue damage, okay? Again, it's not a band-aid approach like we see with most conventional medical procedures, but it really is meant to provide long-term relief. I know, for example, I have had stem cell therapy in my knee. I've also had PRP, or platelet-rich plasma injections in my knee, which I'll talk about later. And they have absolutely given me a new lease on life. I'm a lifelong athlete, and I enjoy being active in leading a vibrant lifestyle. I like to role model for our clients and patients. But for a long time prior to my stem cell treatment, I had chronic knee pain from an ACL repair about 15 years ago, and it's been the pain and the swelling has been nagging me ever since. And I recently got stem cells for it in January, and January 9th specifically, and I was out skiing out west on February 14th. So it has given me a new lease on life, and it's certainly I expect it to give me long-term relief as well. And that's my hope for all of you. So why regenerative medicine is now mainstream? Well, most people have heard about stem cells by now. 10 years ago, we were just starting to hear about it coming on mainstream, but now most people have heard about it. Why? Because one, it works. Two, it's very safe. There are no significant adverse side effects, which I'll explain why a little bit later in the webinar. Three, the results are often long-lasting, 1 year, 2 years, 3 years, 5 years later. Some people say that they saw their physician, they were prescribed therapy, they did a stem cell treatment or other regenerative medicine procedure, and they've never had to have surgery. So, also the pain relief is dramatic. As I said, I would have constant chronic pain, and the swelling was, honestly, not only was it uncomfortable, it was embarrassing. So the pain relief can often be dramatic, and believe it or not, it's a lot less expensive than a major surgery. Let me give you an example. A knee replacement, which, everybody's getting their knees and hips replaced these days, right? But its typical knee replacement runs about $65,000. Now, most people have insurance, which is great. But even with insurance, most people are responsible for their deductible. And then they're responsible anywhere from 10 to 20% of that $65,000 bill. So your copay for that knee replacement is going to be anywhere from $6,500 to $13,000. Now, these procedures don't typically cost that much. Stem cells, they don't cost that much. So it's a lot less expensive than major surgery. Now, let's talk about the new normal. I really want to get in this. Your doctor will say, well, don't come back unless you're ready to do surgery because otherwise I can't help you. How many of you on this webinar have been told that, don't come back until you're ready to do your surgery. Otherwise I can't see you, whether it's a joint replacement or a spinal fusion or whatnot. Well, the truth is, we want to bridge that gap. Regenerative medicine bridges that gap, so that there's often no need for surgery. Let me give you an example, neuropathy, right? Many patients, more and more patients now, whether you have diabetes or not, more and more patients are experiencing neuropathy. Now, there's no surgery that can, fix or cure that, right? Pretty much you're given Neurontin as a medication or some other, like medication used off-label. But now with regenerative therapies, you've got a whole different option. So our goal is to help bridge the gap, so that, we're working well with your body. But what is a stem cell? Let's talk about this. I talked a lot about stem cells and their, what I would call miraculous effectiveness, efficacy during the COVID-19 crisis. So many people were, on their deathbed, and those fortunate few who were given intravenous stem cells and stem cells through nebulizers were able to make, what most people would, deem to be a miraculous result. So much so that the Journal of Virology, in last April's issue of Journal of Virology, was reporting the evidence-based effectiveness of stem cells in turning around severe cases of COVID-19. Why? Because it regenerates. Okay, but what is a stem cell? There are numerous types of stem cells. What we'll focus on in this webinar is what we call a mesenchymal or mesenchymal stem cell. And it's really a primitive cell with the ability to do lots of things. It's a blank slate, if you will. It's good at replicating itself, okay? And so one of the many things it can do is reduce inflammation. That's why it works so darn well in joints, for example, is because it can significantly reduce inflammation. And when you're reducing inflammation, guess what? You're reducing pain. It can fight apoptosis, which is cell death, right? So you want to regenerate your cells. You want to slow the aging process so it can fight cell death. It can also differentiate into multiple tissues. So it can differentiate into bone, it can differentiate into muscle, into fat tissue, into cartilage. So it really is like that blank slate. That stem cell is going to migrate to the areas of your body that need it, and it's going to, replicate itself. It's going to make itself into whatever your body needs. So, as I said, it's self-replicating too, so it can make more stem cells. Remember from, was it 6th or 8th grade biology? You may remember mitosis, where cells are able to replicate. So the stem cells turn into specialty cells and basically become like a worker bee. So where the stem cell is, it's told what it needs to become. So let's say you've got inflammation in the knee. The stem cell migrates to the knee, and it's told by that part of your body, hey, turn into cartilage. Hey, I need you to help heal and repair this muscle. Hey, I need a little fat around here. Hey, I really need you to restore, bone density and strength. So it's like a worker bee, okay? After, the 5th to 8th time, though, of replicating itself, the copies become non-functional. It's kind of like a Xerox copy. If you're making a copy of the original copy after copy, those copies are going to come out more and more blurred, okay? So that's what happens a lot, too, when people get stem cells outside of the U.S. Stem cells outside of the U.S. are not regulated. Stem cells within the U.S. have high regulation standards for how they're harvested and how they're stored, right? But a lot of times when people will get stem cell therapies out of the U.S., they'll get stem cells that have been replicated over and over and over and over again. And so they're not as vital. They don't have the same level of efficacy as stem cells that come from, the placenta or the umbilical cord, or stem cells that have not been duplicated or replicated. So we'll talk a little bit more about that, in just a minute. But that's basically what a stem cell is. It's a blank slate, basically a worker bee that the body tells it where to go and what it needs to turn into to start regenerating. Now, we do not use embryonic stem cells. A lot of people, worry whether, they're getting stem cells from an aborted fetus. That is absolutely not the case. We use mesenchymal stem cells. They're ethically obtained. There's no harm to the baby or mother, and I'll talk more about this in a little bit. There are no rejection issues because they're blank slate, they're young, they're healthy, they're vital. Mesenchymal stem cells that are ethically obtained have the highest success rate and, have the strongest sense of vitality. Okay, as I said, there's no rejection issues and there's no tumor formation. Unlike embryonic stem cells, which most people think, oh, are you getting stem cells from aborted fetuses? Absolutely not. There are a ton of ethical issues around that. Rejection is actually very common. Okay, there's replication issues when you try to replicate a stem cell from an aborted fetus. It often has led to tumors. Okay, and this will be in research phase for many, many years to come. Okay, so there's a lot of papers, a lot of research that mesenchymal stem cells, those that are harvested from donors, they don't cause tumors. They're called non-tumorigenic, and want to make sure that you fully understand that they are not taken from aborted fetuses. Now, we need to talk about exosomes direct cell communication. What do I mean by that? So I said there are different types of regenerative therapies. Stem cell is one. So we've got mesenchymal stem cells. Then we've got something called exosomes. It's not a cell really, but it's a byproduct of a stem cell. So it actually resides within the stem cell there. If you can see the picture of the stem cell, the exosome resides within the stem cell. And it can use these, the exosomes can use these, you can use these by themselves and with stem cells to get greater regenerative properties. It's what we call cell-to-cell communication. So the exosomes will exit the stem cell, or we can take exosomes from the stem cell and use them by themselves. But they're really vehicles or vesicles rather that get released from the cell. So they go outside of the cell. So exo means outside of the cell. They don't have DNA, but they've got a ton of rich information inside it. RNA, cytokines, proteins, growth factors. What the exosomes do is they find a target cell in need of them. So let's just say damaged cell or damaged tissues. And then they release their payload to those cells, and they're told to regenerate. So basically, you've got an exosome that comes out of a stem cell. It fights its way to the cells in your body that need it the most, and then it dumps its payload of RNA, cytokines, proteins, and other growth factors right into those cells, telling it to start to regenerate. So that's an exosome. Now, as I said, exosomes direct communication. Pretty remarkable, okay? But let's talk a little bit more about cell communication. Oops, sorry about that. As I said, it basically dumps the load of the RNA, the growth factors, the cytokines, and the proteins exactly to where it needs to go. Now, check this out. We talked about donor umbilical cord stem cells, placental cord stem cells. This is a highly regulated process by the FDA. So the first part of the process involves getting the consent of the mother's consent months before birth. So this is a process that's actually started several months before the mother gives birth. There's a lot of screening that happens before the birth. They want to make sure that there's no risk factors involved. The screening is so rigorous that only 10% of eligible women actually qualify to donate mesenchymal stem cells from umbilical cord or placenta. So it's highly regulated. Then, the collection process is pretty highly regulated too. The donated tissue is collected by a licensed professional at the time of birth and shipped overnight to our laboratory. And again, laboratories are highly regulated by the FDA. Processing happens upon receipt of the tissue. The lab techs utilize Invidic's proprietary methods to process the tissue. And they don't, unlike many labs outside of the U.S. and some labs within the U.S., certainly not our lab, they don't radiate the stem cells. When stem cells are radiated, a lot of them die off. We don't do that with our labs. In fact, our labs use certified good manufacturing process standards. Our cells are 80% viable through cryogenic storage, completely ethical. So they get processed and then they get preserved through cryogenics. During the processing, a cryopreservative is introduced to the tissue, and this allows the tissue to be stored at minus 80 degrees Celsius. Then those cells are quarantined. The newly processed allografts or stem cells are quarantined for a period of 2 weeks pending, in which the tissue is tested for infectious disease and microbial contamination. So very, very, very thorough process. Then they get released. The quality assurance identifies allografts to have passed all required testing, including infectious diseases and microbial testing. Then we have access to those. As I said, our cells are 80% viable through the cryogenic process, completely ethically obtained. So I want to be clear that stem cell therapy is not a cure. It changes ratios. Although I think if you go online, if you tune into the 8-hour masterclass that I offered earlier in the webinar, you're going to realize that many doctors are believe that stem cells are curative. Although I cannot make that claim legally. Okay, so we get asked that a lot. Are stem cell therapies a cure? Okay, well, will this cure my kidney failure? No. Will it cure my diabetes? No. For example, cartilage formation in a joint. When we make cartilage the same rate throughout life. So when I talk about changing ratios, it's not going to cure things. It's going to help balance things. For example, when we're younger, we make, a regenerative cartilage at the same rate throughout life. It's a one-to-one basis. It's the same rate at which we lose it. So let's just say growing up, we're going to, maybe get injured or whatever. We're going to lose some cartilage, but our body is still young enough to make enough cartilage to heal, or regenerate that injury. But the older we get, the more we lose the ability to regenerate at the same rate. So we lose it faster than we make it as we age. So when we receive a regenerative biologic like a stem cell or an exosome or something like that, it helps flip the ratios, making more than we lose. So it's kind of like this roller coaster. So if you can see the first downturn, we're able to make, stem cells, at the rate at which we lose it. But then as we get older, we're going to lose that ability. But stem cells then give you a chance at recovering that rate at which your body can regenerate. But over the course of time, you will still begin to lose more of those cells than you make regenerative tissue. So it changes the ratios. It puts you in a position of reducing damage, slowing the aging process, helping to recover tissue, but we can't say that it's a permanent cure or a fix. It changes ratios. Now, regenerative options that are available to you. I like to call this the regenerative umbrella, and it includes PRP therapy, which stands for platelet-rich plasma. It's not a stem cell therapy, but it is very, very effective regenerative procedure. Like I said, I've had mesenchymal stem cell injections in my knee along with platelet-rich plasma injections. We've got bone marrow. That is when your own bone marrow is extracted, and we take the stem cells from that. Adipose tissue, and umbilical cord, amniotic, and placental tissue. So let's talk about those individually a little bit more in depth. Okay. So, and just so you know, adipose is the fat from your own body that contains stem cells as well. So, platelet-rich plasma therapy. This is really kind of cool. It's often used in conjunction with stem cells to amp up the activity of the stem cell. Imagine you're accelerating the activity of the stem cell. It's not a stem cell therapy per se, but it is commonly used in a lot of things: hair restoration, erectile dysfunction, facials. In fact, many people will use platelet-rich plasma, or PRP, for facials, sometimes called, I hate to say this, sometimes called the Dracula facelift, because the PRP is taken from your own blood. It's spun in a centrifuge, and then the platelet-rich plasma is separated from the red blood cells, and then that is what's used for the regenerative part. Okay, so they draw your blood, it's put into a centrifuge, it's spun for about 10 minutes at about 4,000 RPM. Okay, I'll take about 1 to 2 test tubes worth. It's a very straightforward, easy procedure, relatively painless. The platelets are helpful in healing. They contain a ton of growth factors, and it's those growth factors are kind of like construction foremen. They tell your body what it needs to be used for, whether it's musculoskeletal, whether it's in your joints, whether you have plantar fasciitis or elbow pain, maybe you've got rotator cuff or shoulder pain. So those growth factors are like the construction foreman. They tell that platelet-rich plasma exactly where it needs to go in your body. Okay, but this won't change the ratios, but it will slow down the joint degradation or the tissue degradation. So it's not going to regenerate per se, but it is going to slow down the degradation of the cells. Okay, so that's PRP, or platelet-rich plasma. Let's talk about bone marrow next. So it's, this is from your own bone marrow. It's called autologous. So we're seeing this used a lot less frequently now because there's a high incidence of chronic pain that results. Usually you can't harvest enough stem cells from your own bone marrow, and you often need sedation. Okay, and the needle is about the size that you see, in the slide there. It actually goes into the pelvic area to aspirate your bone marrow. As I said, the needle's about the size of a pen, and cell counts matter. If you're not getting a lot of cell counts from bone marrow, it just doesn't make sense anymore for these various reasons to use bone marrow stem cells. And so, like I said, not a lot of places are doing bone marrow stem cell treatments anymore for these very reasons. But you certainly could if you want. It's one option under the regenerative umbrella. Let's talk about stem cell fitness. MSC stands for mesenchymal, sometimes called mesenchymal. So if you're 25 years old, and maybe you want to use stem cells from your own bone marrow, go for it, because you're going to have a lot more stem cells at 25 than you will at 35, 45, or 55. But still, as I said, it's not the best option. Let's talk about how our body dramatically experiences a reduction in stem cells as we age, and why it's so important to get stem cells that are young, healthy, vital, from umbilical or placental donations. So a newborn at birth makes 1 stem cell for every 10,000 cells. Okay, now it doesn't sound like a lot, but that's a lot. By the time we're in our teens, the rate of our stem cell production significantly declines to 1 for every 100,000 cells. By the time we're 30, our body only produces 1 stem cell out of every 250,000. By the time we're 50, it's 1 stem cell out of every 400,000. And by the time we're 60 years old, you're producing 1 stem cell for every 2 million cells in your body. So stem cell fitness, not only the amount of stem cells, but how healthy and vital they are significantly declines with age as well. So mesenchymal stem cells are adult stem cells traditionally found in the bone marrow. However, mesenchymal stem cells can also be isolated from other tissues, as we said, including donated cord blood and umbilical cord tissue from donors following normal C-section births. Okay, these are all from a normal C-section birth. C-sections that have been pre-scheduled. They're multipotent stem cells. Mesenchymal stem cells differentiate to form adipocytes, cartilage, bone, tendons, muscles, and skin. Okay, so want to make sure that your stem cells are young, they're healthy, and they're vital. And this is why, as we age, it's so much harder to recover fully from injury, because our body isn't making those stem cells at the same ratio it was when we were a lot younger. Now, let's talk about adipose, or fat from your body, because you can get stem cells from fat from your body. It's often called a mini liposuction. You won't lose a lot of weight, though. So if you're doing this to lose weight, there are better, healthier options. High cell counts. They generally don't get lazy. Meaning some stem cells, if they're old, the older you get, the lazier those stem cells are. So it's not a bad option, because as I said, you can get high cell counts from stem cells from your fat. But there is a problem with cell death. So they need a lot of oxygen. But it's still a fantastic option. It's the second best option compared to mesenchymal stem cells from donors, umbilical or placental donors. The procedure takes about 45 minutes. They actually take the fat from your body. It's done in office. But as I said, they often don't do well. So, unlike the stem cells we get from our labs, 80% viability, you're not going to have that level of viability if you're getting stem cells from fat, because of how they're harvested. So, not a bad option, though. You can see here a graph of the procedure. Like I said, it's done in office. These are some, docs that are being trained. This picture was actually taken at one of our training sites. I think it was taken in Tennessee. But it is a very good procedure, but it's second to other procedures. Overview of amniotic and umbilical cord cell therapy. So, as I said, it's ethically obtained by donors, and this, the donor is highly screened. They are from C-section only, and consenting mothers have scheduled this well in advance. Highly FDA regulated, no embryonic stem cells. I want to continue to reinforce that. Now, what are some specialties where stem cell therapies are applicable, or regenerative therapies are applicable? Well, they're being used very often in pain management. They're used often in orthopedic settings. As I said, there's a lot of cosmetic applications now. Hair restoration, facials. It's used for sexual wellness. Individuals that have, maybe dealing with erectile dysfunction or other sexual health issues. It's been used for cardiology purposes, so heart issues, pulmonary issues. It's been used a lot over the coronavirus. It's been used for individuals with COPD with stellar results. I'll give you an example. Our medical assistant here has been dealing with COPD since early in childhood. She received nebulizing treatment of stem cells, and within 4 minutes she raved about how well she could breathe. In fact, she said, "I haven't felt this good and breathed this easily since I was 6 years old." And that was in January when she got her stem cell treatment, and here we are in April. She's still experiencing remarkable results because it's regenerative. It has healing properties. So it's often used, for pulmonary issues. Okay, it's used often in neurology, individuals recovering from strokes, individuals dealing with ALS. It's often used in urology, endocrinology. A lot of times, people with diabetes will opt for stem cell treatments. It's been used in ophthalmology for issues with eyes, certainly nephrology, so issues dealing with kidneys. We have treated individuals, thousands of individuals have been treated successfully for issues related to kidney failure. And certainly rheumatology, right? Autoimmune diseases, as we said. So several applications. I do want to say the FDA has not approved stem cell therapy for any condition except some cancers. So we're not making any claims regarding stem cell treatments, but these are what stem cell treatments are being used for. Okay. Treatment decisions are made between you and your treating physician. Just want to be super, super clear and transparent about that. So a wide variety of applications. A lot of times people just think of stem cell treatment as, for joint pain or shoulder injury, those kind of things, but it's been used widely. We just treated a woman last week with autoimmune condition. She did IV stem cells here, and she was really excited about the procedure because what the research and what the results are showing are pretty remarkable, that has been used successfully off-label. In fact, you should know most medications, most treatments are used off-label. Okay, so how does the biologic know where to go? The biologic meaning the stem cell or the platelet-rich plasma, the exosome, and there are many ways you can do it through IV infusions for people with systemic health issues. Maybe it's diabetes, maybe it's an autoimmune condition, maybe it's kidney condition. That is IV stem cell therapy. It's very easy. It's quick. Takes about 20-25 minutes. Certainly you can do injections, for example, knee, joint, those kind of things. Nebulizer treatments for, issues with lungs, whether it's COPD. So you can do intranasal, okay? But it's not random. The stem cell knows exactly where to go based on inflammation. Let me tell you a little bit more about that. So stem cells, I took this from the journal. But stem cells attracted by tissue inflammation. So it is not random. The stem cells go where the inflammation is. So that's why it works so well for regenerative purposes. The people might say, well, how does the stem cell know where to go? It's very, very intelligent. Our body is remarkable in its innate capacity to heal itself. So the cells can be deposited in multiple areas of the body. Maybe you've got inflammation in your knee. Maybe you've got inflammation in your lungs. Maybe you've got inflammation in your kidney. Well, the stem cells are going to migrate to the areas of your body that need it. Okay? They know where to go. There's an intelligence about that. Now, there's different types of products. Your stem cells and donated stem cells. Okay? As I said, you can get your stem cells from the adipose, that mini liposuction procedure. Okay. Again, there's high cell counts. Uses a kit plus a centrifuge, but it is more invasive, and there is some cell death because of the procedure. And you can certainly get stem cells through your own bone marrows. The iliac crest aspiration, that's by your pelvis there. But as we said, that's not the best option, and fewer practices are using this option. Or you can get donated stem cells, those umbilical cord with amniotic, hyaluronic acid, cytokines, over 70 different growth factors, and stem cells. So wow, talk about a difference, in the quality as well as the quantity when we're talking about umbilical cord stem cells. So how does the FDA view stem cell therapy products? Let's talk about that, okay? Basically two categories. The first category is what we call minimal manipulation, meaning it's not being cultured, so we're not doing anything to change the cells. We're not replicating the cells like they often do outside of the U.S., okay? And we use this type because it's the only type that's acceptable to the FDA. Okay, it's okay in the United States. Same setting procedures, meaning we do it in office. There's no culturing to expand cell counts, so we're not replicating them and then having weaker and weaker, less and less effective stem cells. And there's no enzymes or additives that change the biologic structure of the stem cell material. So it's first generation cells that are more potent, they're more powerful, they're alive, vital cells. Okay. And then the other type is maximal manipulation. It is not allowed in the United States. It actually turns the biologic, whether it's adipose stem cells, bone stem cells, into a drug. That's one of the reasons stem cell treatments outside of the U.S. are not as efficacious. They often involve a lot of culturing and additives, so they'll add enzymes. You see this performed internationally in countries like Mexico or the Cayman Islands, the Caribbean, Panama. In fact, Canada doesn't even allow stem cell therapy. And the cost outside the United States also is exorbitant, anywhere from $25,000 to $40,000 on average. So in the U.S., you can't culture or add enzymes here, okay? Until replicating these cells, the replication of these cells actually break them down, and then they become non-functional stem cells. So beware if you're considering any kind of stem cell treatment outside of the U.S. because they're maximally manipulated, and they break down. Okay, so you may be told, hey, you're going to get 100 million stem cells, but 80 million of those 100 million stem cells aren't even functional. Okay, so just beware. Our cost for stem cells, extremely competitive, extremely reasonable, because we have buying power. We partner with other stem cell practices around the country so that we get really, really good buying power. And as I said, the cost of stem cells, pure, healthy, potent, powerful, alive, vital stem cells, is often less than your copay would be from a procedure. Okay. Let's quickly talk about what's called the FDA 3-lane highway. This was developed by Dr. David Green, our trainer and mentor. He developed this a while ago. So the FDA basically has 3 lanes. They regulate things called devices. That would be like a knee replacement or surgical screws. They regulate drugs, right, through clinical trials, which on average take about 3 to 7 years. Again, you should know 80% of all drugs used today are used off-label. Reason they weren't approved, for reasons they weren't initially approved, much like TMS. TMS was FDA approved for depression, but it's been successfully used off-label to treat anxiety, post-traumatic stress disorder, Asperger's disorder, fibromyalgia, Parkinson's dementia. Same thing with drugs. Neurontin, for example, gabapentin, originally FDA prescribed to prevent seizures, but now it's often prescribed for neuropathy pain. So drugs are highly regulated, and 80% of all drugs are successfully used off-label. And then we've got the third lane, the biologics. Okay, and biologics are neither approved or disapproved by the FDA. What they do is they evaluate the labs, and they approve or disapprove labs. So the labs where stem cells are cultured and stored are federally regulated, and they're all donated tissues. Okay, and there's very, very, very strict record keeping. So if you're going to get stem cells, here in the U.S., you're really going to get good, high quality stem cells. Certainly from our partners at R3, you're going to get exceptionally high quality, young, vibrant, vital cells. But that's generally how the FDA regulates things. So when people ask, is stem cell therapy FDA approved? It's not approved or disapproved. They approve or disapprove the labs. Okay. Now, what's in umbilical stem cell tissue? It's basically, there's a lot that goes into it. It's basically like motor oil. We've got hyaluronic acid, which lubricates our joints. A ton of growth factors. In fact, there are over 80 of them. These are, again, what I call the construction foremen. They're to direct the repair process. You've got cytokines, which are anti-inflammatory mediators. These, lower autoimmune responses, for example. There are no steroids. It's not a steroid at all, so there are no side effects, okay? None. And there are a significant amount of stem cells in it, okay? And then we've got the additional elements, mRNA, exosomes, secretomes, okay? If the lab is careful, there's not going to be any preservatives, there's no radiation, you're going to get a lot of exosomes, secretomes, etc. in that stem cell. So that stem cell is loaded with lots of goodies. Okay. It's kind of like a symphony though, right? Whether or not you're, an aficionado of the orchestra or the symphony is greater than the sum of its parts. you want your biologic, you want your stem cell to be greater than the sum of its parts too. So the stem cell has all the sections to work together to get the best results. It's got the growth factors, the cytokines, the proteins, the hyaluronic acid, everything, all the parts, the sum is greater than parts. All those parts are taken together for harmony in your body when you get good stem cell treatment. Okay. Questions we hear all the time. How quickly will it work? I asked the same thing when I was talking to Dr. Burtis. I'm like, Doc, how quickly, are the stem cells going to take effect? Okay. Well, the truth is people are different. We metabolize different. Our mitochondria are different. It can take anywhere from a couple of days, couple of weeks, couple of months. When somebody gets the stem cell treatment here, we'll schedule a follow-up 6 months after the stem cell treatment. Mine started taking effect pretty quickly. As I said, I got my stem cell and my PRP injection on January 9th. I was out skiing at Big Sky, Montana, out west on February 14th. So pretty awesome. So how quickly it works, it really depends. How long does it last? Well, there's systemic effects. If we're talking about, stem cell therapy to treat, systemic conditions such as autoimmune conditions or organ conditions such as your kidney, it may take a couple of months, right? So it really depends on what it is that the stem cells are being used to treat, what condition, how severe that condition is, and how good your health is overall. Does insurance cover it? Stem cell therapy is not covered by insurance. We do have a type of regenerative medicine treatment called an allograft that sometimes is covered by insurance, but it's very policy specific. But stem cells per se are not covered by insurance. Some of the things people ask are, what is it, that I'm going to experience? Well, people generally report increased energy. They find that they're sleeping better. They find that they're experiencing a lot less joint pain, discomfort, those kind of things. People often ask about cost. So the cost varies. As I said, we work with one of the larger labs and stem cell providers in the country. And so we have buying power. So PRP or platelet-rich plasma, on average, depending on where you live, is going to cost anywhere from $800 to $1,200 per treatment, and usually it's recommended 3 treatments. Stem cell exosomes are about $2,500. Okay. Stem cell therapies can range anywhere from $3,500 for 1 cc, and 1 cc gives you 10 million live cells. Anywhere up to 7,000 for 2 cc's. 2 cc's are going to give you 20 million cells. As I said, stem cell therapy is often a lot less expensive than the co-pays following a surgery or another procedure. The stem cell recruitment therapy, what's known as the allograft, as I said, some insurance companies may cover that. We have financing available. We've got some fantastic payment plans. We've got a 0% finance option available. We've got financing options available up to 60 months without any prepay penalties. So we offer therapies. We even offer a therapy commitment for 1 year. So basically, we are among a handful of practices in the nation that will offer a therapy commitment for a year. So if you or your doctor aren't happy with your results, we will redo that exact same procedure at one of our training workshops throughout the year. And it happens very infrequently. I mean, our parent company has, done, the therapy commitment for some patients, but it's very, very rare. But know that if you get stem cells at our practice, we are going to guarantee that for a year. So if you and your doctor aren't happy, we'll redo that same procedure at one of our training workshops. Okay. What other healthcare practice, in the nation is going to give you a therapy commitment? Very few that I'm aware of, but I am proud to say that we will. Now, let's talk about next steps. Okay. So we've got more than an 85% patient satisfaction. We know because we survey our patients, when they come in, how they're doing over the course of their follow-ups, right? We offer a free consultation, so I'm happy to meet with you. I'll spend an hour going over your condition. We'll take it knee to knee, eye to eye, and we'll take a deep dive, get all of your questions answered. As I said, there is a very special offer. I'm offering $500 off procedures if you mention that you watched the webinar. And as I said, we're one of the only companies nationwide to offer a therapy commitment. So I would like to invite you to schedule a consultation with me. You can visit us online at thecifhw.com. Again, thecifhw.com. You can call us 630-980-1400. Again, 630-980-1400. Or you can send me an email directly. That email address is healthandwellness@thecifhw.com. Again, healthandwellness@thecifhw.com. I want to thank you for tuning in to tonight's webinar. If you've got questions, again, please give me a call, 630-980-1400. I'm happy to answer them. Again, send me an email, healthandwellness@thecifhw.com. And certainly you can visit us online at thecifhw.com. So hopefully you will have enjoyed the presentation. I hope that you got a lot out of it. You have a better understanding of the different types of regenerative therapies, the stem cell, the PRP, the exosome therapy, the allograft therapy. Know that they are harvested, very, very ethically, highly FDA regulated within the labs, pure, potent, very bioavailable, and I can say with certainty and with confidence that it's worked well for myself. It's worked really well for a lot of our patients and clients. They've been very, very satisfied. And if this sounds like it's a good treatment for you, I'm going to invite you to schedule a consultation, and we'll go from there. Thanks a lot. We'll talk soon. Bye-bye.